Time for another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody.
Well, today we're going to talk about many different things, but we're going to start off with cholesterol and statins.
Right. Cholesterol. Is it a good thing? Is it a bad thing? And how does that relate to heart disease? And so the old Paul Harvey, what did he say? And now you know the rest of the story.
Mm-hmm.
Well, we're finding out more and more about the rest of the story on a lot of things when it comes to these practices, these dogmas, these kind of things that have been set in place as far as if we want to reduce risk, we do this. We prescribe this drug. And when it comes to the whole cardiovascular disease debate, the whole question was coming down 2 years ago, is cholesterol the problem in what was feeding it? Or was it not the problem that it was created to appear to be? So it was in the 60s and 70s that this debate came about, and at least as far as I can tell, there was a couple schools of thought out there. One was that it was related to high fat, that the elevated cholesterol and heart disease was related to high fat. The other school of thought was that it was related to sugar. And one angle and one side of that story won out, and we know what one that was. And an industry, being the statin industry, got behind this push and this narrative that the lower the cholesterol, the lower your risk to develop cardiovascular disease. And we're actually starting to see some evidence, a pretty good body of evidence of the opposite of that. And over the years, cholesterol, the numbers that the institutions have put out there as these are the numbers or goals, kept getting lower and lower. Now, there are some doctors across the world. Dr. Malhotra is a pretty world-famous cardiologist that has come out and is, I guess, what you would call a statin denier now. Pretty much any cardiologist over the years has always been pushing statins to lower cardiovascular risk. And so now he, along with many others in this country, are starting to take another look at the whole body of literature and evidence and how it came to be that statins kind of became a fixture. So we really developed one thing that's interesting when I look back too is this Framingham risk score that I used to run, and most doctors run on their guest, their patient, and it says if they're high risk, we run in all these different quote-unquote risk factors. Most everybody comes out, it seems, over 40 at moderate to high risk, and, well, you need to go on a statin then. And so, and quote-unquote, and then what ends up happening, that's kind of set as a standard of care, the expectation, and then there's not much else done to look into, is that really the best thing? Are we revisiting this over time and looking at this literature again to make sure that that is the best practice? And we're finding out that there is plenty of evidence to suggest you, at a bare minimum, should have a conversation with your physician and do some research on your own and make that determination, because it tends to look like the inverse. The lower the cholesterol, that we're seeing the increased risk of cardiovascular disease. And then you and I, Dave, we've talked countless times about statins and all the things that, I mean, it happened to me over the years. My patients would come in and they would say, yeah, I've got a side effect. I had so many patients that came in with side effects on statins, and I'd switch them to a different one, when the overall benefit to maybe increasing their length of life a few days by being on the statin for many years compared to all of the downstream risk. And again, the side effects are one thing, but then again, it's the correlation with diabetes, the correlation with dementia and brain health and memory loss, and your body's ability to make hormones, your body's ability to make ATP, which is a energy producer in the mitochondria. You need coenzyme Q10. Well, when you're on a statin, you're depleting your coenzyme Q10 resources, and so you're decreasing your ATP production. So the bottom line, this all circles back to on, everything that we talk about. We're looking more at inflammation, and we're looking at these pharmaceuticals. Should they be something that maybe should, in many cases, be something that is a bridge until we can work to get the body back into balance. Now, of course, sometimes the body is so far in an advanced state of disrepair, scarred over, been living with it for a long time, that it can be a bigger challenge, and some folks are left with having to remain on some pharmaceuticals. But that's why it's important to address these things early on, because many times we don't have to be on them indefinitely if we're able to make the changes that we need to make lifestyle-wise and get the body back into balance. Then the body doesn't become dependent on these things, and the body can kind of work to heal itself again.
Couple of things. I've actually followed this issue a little bit. One thing they found out, especially for brain health, that indeed cholesterol was a positive for your brain. Right.
I mean, the brain tissue is largely made up of some protein there, but a lot of cholesterol and fat. And in fact, that's why, when the babies come along and we always talk about getting them in a high-fat diet, and that's why that baby mama's milk is so good, the colostrum that is so rich in fat. Why is that? Well, it's feeding that brain tissue. It's helping that brain tissue secure and grow connections. So absolutely, it's huge. And we're doing the reverse with it. We're causing misfiring. And my dad was an electrician, and I think of the wires that start to fray and lose insulation on them. Same thing. You want that insulation on that copper wire in order for there not to be a short.
Well, and we're out of time, as we always seem to make happen here. But the other thing is, when you add another drug to the cocktail, right? So
yeah.
if the drug is just standing on its own, but let's say you're taking a blood pressure pill, maybe you're taking something for anxiety, and now you throw in a statin, you're counting on that statin to be able to mix beautifully with the blood pressure pill and the anxiety pill. And every time you throw a new drug into the cocktail, you don't know how that mix is going to turn out.
True. And these are petrol based, so not your organic purest forms of therapy. So it's like throwing plastics in many cases into the body, and then how they interact with each other. So then that liver that is then got to process all of those things is stressed already because of our nutritions and our diets and our environment. And so the more that you throw those synthetic pharmaceuticals that have these potential interactions together. It's a soup of many cases of distress that our body has to overcome. So, there's some side effects that drugs that you want to have when you're on them. But I remember my pharmaceutical teacher at Des Moines University. She said all pharmaceuticals are toxins. Just remember that they're all poison. And she's like, but some of them have the side effects we want to have. As long as we got more of them that are doing the net positive versus the net negative, we're good.
Mm-hmm.
And so that always kind of stuck with me. So just remember that, yes, again, there is a time and a place. Sometimes we need them, but they are not, they're not a natural part of our constitution and body. They are a means to an end sometimes that we need as a stopgap on a bridge, but our body, it's not a natural phenomenon for our body to have in us.
Well, let me wrap up with this. As someone who's had some chemotherapy, when you use chemotherapy, you use it for a specific result, right? But when you have to use, in my particular case, after my usage of chemotherapy, when I have to use a different bathroom than anyone else in my house because of the chemotherapy I took, you kind of know it's a toxin.
Exactly.
All right. So if anybody wants to talk to Dr. Bradley Meyer about statins or anything else they got going on respective to their health, how do they get a hold of you?
Yeah, give us a call at 712-339-6024. We're at the Okoboji Wellness Clinic in Spirit Lake, Iowa, off Highway 71, 3305 Berquist Avenue. We got a great team here that's ready to support you on your wellness walk. We are bringing the hope and helping that body, assist that body do what it wants to naturally do. That's heal. So give us a call if you got questions, and we can get you on that path.
Very good. Dr. Meyer, always a pleasure. Have a great day. We'll chat soon.
Sounds great, Dave. Take care, everybody.
Thank you. Dr. Bradley Meyer at Okoboji Wellness Clinic. You can also find him online, okobojiwellnessclinic.com.